Good morning. Welcome back to Open School series on ABG case discussion. Today I'll be discussing a patient with bronchial asthma, severe acute asthma, and an ABG was done. So, 32-year-old female with acute severe asthma. Respiratory rate is 28, so there is tachypnea. Heart rate is 140, tachycardia. Unable to complete sentence. So patient has got severe respiratory distress. He is on oxygen 15 liters per minute by a non-rebreather mask, and ABG was performed. So we have got a clinical data. Patient has got a acute severe asthma. So the patient is hyperventilating. What we expect will be patient will be having a low PaCO₂, oxygen tension may be less, and patient may be having a respiratory alkalosis. That is what we are expecting. We look at the ABG with this clinical data. So look at the pH. pH is 7.41. It is normal. Now the range is 7.35 to 7.45. PaCO₂, as expected, is low. So that is a, and the PaO₂ oxygenation 7.4, normal is 10 to 13 pKa, so it is low. And the bicarbonate is within normal range, 23.9, normal is 22 to 28, so it is again normal. So there is a base excess, 0.8 millimoles. So again, this is normal. So apparently this patient is having a normal ABG. So we will interpret stepwise. So step 1 is assessing the pH. So 7.41, is it acidemic or alkalemic? So it comes the normal range. So the interpretation, this is normal. So the first step in interpretation of ABG is looking at the assess the pH and see whether it's acidemic or alkalemic. So second step, you look at the carbon dioxide. That is the what about the ventilation. So PaCO₂ is 3.5 kPa. It is low, and we can explain that this is due to hyperventilation. In an asthmatic patient, a normal carbon dioxide is abnormal because patient is breathing rapidly and you expect it's a low. So that is important point to keep in. Next, we look at the assess the bicarbonate. So bicarbonate is 23.9. So normal is 22 to 28. So it is again normal range. So looking at the pH, then we look at the ventilation, that is the PaCO₂. Now we look at the bicarbonate, whether what is normal, again this is normal. So now we'll be looking at this. Step 4 is looking at the oxygenation. You may, in the very beginning, you may go for the oxygenation because a low PaO₂ is very important. So this step can be either used here or start with oxygenation, ventilation, and pH. Anyway, you can go. So PaO₂ is 7.4 kPa. Normal is 10 to 13. So there is hypoxaemia. So this indicates the patient has got low oxygen. So this means patient has got hypoxaemia. And there are two types of respiratory failure, type 1 respiratory failure and type 2 respiratory failure. You can see that this patient is having a type 1 respiratory failure. Why it is type 1? Because the carbon dioxide is normal, oxygen is decreased. So in a hypoxemic respiratory failure, so that is the patient has got a type 1 respiratory failure. That is decreased PaO₂ with a normal. So PaO₂ is decreased, PaCO₂ is normal. This is type 1 respiratory failure. If PaCO₂ is decreased and PaCO₂ is increased, that is hypoxemic plus hypercapnic, this becomes type 2 respiratory failure. Now, we look at once more regarding the types of respiratory failure. Type 1, PaO₂ is decreased, in PaCO₂ is normal or decreased. Because of the hyperventilation can get in asthma, pneumonia, pulmonary edema, because all these conditions the respiratory rate is increased. Type 2 respiratory failure occurs the PaO₂, that is hypoxemia plus hypercapnia. Classical example is the COPD, any patient with hypoventilation, neuromuscular disease, somebody has got a myasthenia. Modern known disease, you may get a findings like this. Now, assess the oxygenation once more. The rough guide for oxygenation expected PaO₂ in kPa will be FaO₂ minus 10. So, FaO₂ on 15 liter per minute is equal to 60%. The expected PaO₂ will be 50. So, actual PaO₂ here is 7.4 kPa, much lower than the expected. So, it suggests a severe ventilation perfusion mismatch. That is, ventilation is there, but the perfusion there is a despite high oxygen delivery. So, the next session I will explain how to calculate the expected PaO₂ in millimeters of mercury. So the interpretation will be the pH is normal, PaCO₂ is low, bicarbonate is normal, PaO₂ is low, there's hypoxemia type 1 respiratory failure due to acute severe asthma. So the clinical message is, let's say patient has got a low PaCO₂, the patient is hyperventilating. Rising PaCO₂ is a sign of fatigue and impending type 2 respiratory failure. You have to need a intervention. This is what I have already mentioned. A patient with acute severe asthma with a normal PaCO₂ is a warning signal. Then the patient may go for or need intubation and ventilation. Stay tuned for further clinical interpretations on ABG. Thank you.